Hello, and welcome once again to HDtv Health District Television, brought to you by the Southern Nevada Health District. I'm Brian Gresh.
Nevada's teen pregnancy rate is troubling. We rank 47th worst on the list of 50 states. In 2008, teen pregnancy cost Nevada taxpayers $84 million. Related issues of HIV and AIDS in teens cost $21 million, and STD costs were about $7 million.
Teen pregnancy affects all of us. So not only does teen pregnancy affect the parent or the teen parent or their families, it also affects the taxpayers. Teen mothers are more likely to be recipients of public assistance. Teen mothers are less likely to graduate from high school. So that begets a cycle that society in turn pays for.
We're ranked 47th out of 50 in teen pregnancy. What we look at are what we call social determinants of health. What are those things that contribute to health status? And a lot of it is public policy. So you have to look upstream to those issues that really impact the population, the entire population. So if we look at public policy, what do our NRS statutes say? But we also have to look in terms of our educational process in the school system. Are we giving teens enough age-appropriate information to allow them to protect themselves?
Providing non-judgmental, medically accurate, and age-appropriate information to teenagers who are between the ages of 13 and 18 is the priority of the Health District's Teen Pregnancy Prevention Program.
We have a teen hotline, and that number is 759-0894, 759-0894. It's a teen-only hotline. So the teens can call that line to get information about birth control. Teen girls can make appointments for birth control. They can call that number to find out how to access free condoms. And then they also can call that number to sign up for one of our classes. We offer Be Proud, Be Responsible at the SNHD location in East Las Vegas on Nellis.
All services provided by our health educators and clinics are confidential. They require no parental permission and are open to boys and girls. Teen pregnancy prevention, however, isn't just about young people. It's a program that provides information to parents as well. What
we found is that parents do want to be the ones to talk to their kids, but very often they're not sure themselves what information to give. They don't know medically accurate terminology for how HIV is transmitted or even how you get it. They may not know the anatomy of how a person gets pregnant or the biology of how a person gets pregnant. Their comments to us was, we need to be educated and we need to have that information.
Some things stay the same and some things do change. And that's the reason we're having these parent workshops, the coalition, is because some parents, they base their experience or the talk that they did not have with their parents based on how they should communicate with their child. So teens today are actually very comfortable in their own skin. The teens are maybe pretending as if they're not listening to the adults, but they really are taking in that information.
Because teen pregnancy has such a huge impact on our community, the Southern Nevada Teen Pregnancy Prevention Coalition was formed last summer.
When you can't do anything by yourself, you need to collaborate. So we need the collaboration, and then also we all have different strengths and we all have different weaknesses, and then there's different opportunities. The coalition is designed to do things that that SNHD, that we do not, that the health educators, our small team of health educators, cannot do on our own. The coalition can advocate, something that necessarily that we can't do at SNHD. So the coalition itself can advocate for sexual and reproductive health. The coalition can educate. The coalition can provide services and resources that SNHD alone cannot do. Plus, the grant that SNHD has for the Teen Pregnancy Prevention Program is limited. The purpose of the coalition and why SNHD is involved in this Teen Pregnancy Prevention Coalition is to keep the mission and to keep the energy and the actions of all of these teen pregnancy prevention initiatives going through the coalition, so that the coalition can be sustainable beyond SNHD's grant period.
Teen pregnancy prevention and STD and HIV prevention involve parent and youth workshops, role-playing, awareness campaigns in all forms of media, and accurate information.
Our staff does a really good job, and they're well trained, and they are able to build a trust and a rapport. The teens' confidentiality is protected, and so they don't have to be afraid to ask questions that they may not want to ask their parents. But parents too told us in the focus groups that they feel comfortable, even though they do want to be the primary source, but they also want safe places for their teens to go to get the right information, right? Because the internet is not always the place to go to get the right information, and other teens are misinformed as well. And what parents don't want is for their teens to learn through their peers or from resources or sources that are not credible.
Sex is more than just the physical act. Sex is emotional, and before sex there is a relationship. So, and it doesn't necessarily have to be marriage or a courtship, but there is some type of relationship with that person. I'm not saying how long or how short that relationship should be, or how long or short it is, but there is something, right? So we want healthy relationships. There's trust, there's communication, there's support, there's different things that parents can start talking to their kids about as early as age 5 or 6. Friendship, bullying. What if someone says something to you or or forces you to do something that you don't want to do? How can we deal with that? And that's building those refusal skills. So we walk them through that stop technique, and we give them a chance to actually practice in a room with their peers. So if and when that situation occurs in real life, they've already kind of been prepared for it, and we've given them feedback, we've done role playing and acting. In fact, they create their own situation. So the point of it is that they get to practice, they get to interact with their peers, however they're preparing themselves for real life situations.
The Teen Pregnancy Prevention Program is located in the Health District's East Las Vegas clinic. If that is a difficult location for you to access, or if you're a teen who is too young to drive, you can still get help.
That teen can call 759-0894, and a health educator will be available to talk to that teen. But anytime Monday through Thursday, that teen can call between 8 a.m. through 6:30 p.m. and a health educator is on staff to answer questions. Am I normal? Is this normal? What happens if? No, we are not medical providers, and we cannot diagnose, we cannot give medical advice, but we can educate. We can educate to the best of our knowledge and provide medically accurate, age-appropriate information. And if we feel that that teen really needs those services, we will try our best to work with that teen so that they can get access to those services, or that we can try and get them to come into the clinic if needed. Let's say the teen cannot get to SNHD. We have 2 family planning clinics. We have one in Henderson, and we have one on Nellis in East Las Vegas. If for whatever reason that teen can't get there, I want that teen to get services, and I will refer that teen to a different agency outside of SNHD. The point is that we want the teen to access those services. Yes, we want you to come here. Yes, our services are confidential. Yes, we can provide those services and answer any questions that you may have. However, I don't want to leave any teen standing out alone without access to services.
Whether you're a teen or a parent, you don't have to go it alone. Contact our health educators at 759-0894.